Pharmacology, respiratory, decongestants, pseudoephedrine, or Sudafed, is a decongestant that is available over the counter. Pseudoephedrine is an over-the-counter decongestant. Pseudoephedrine acts directly on the adrenergic receptors and acts indirectly by releasing norepinephrine from its storage sites. The drug produces vasoconstriction, which shrinks nasal mucosal membranes. Common side effects include hypertension, dysarrhythmia, dizziness, headache, insomnia, and restlessness. Some patients may experience blurred vision, tinnitus, chest tightness, dry nose, and nasal congestion. Decongestants are contraindicated in patients with severe hypertension, coronary artery disease, narrow-angle glaucoma, and some antidepressant use. Also used with caution in patients who have cardiac dysarrhythmias, hyperthyroidism, diabetes mellitus, prostatic hypertrophy, and glaucoma. Patient education. Patients must take care to follow dosing recommendations. If dosing standards are surpassed, some patients may experience side effects such as increased nervousness, breathing difficulties, heart rate changes, and hallucinations. Pharmacology, respiratory, antitussives. Dextromethorphan is an example of an antitussive. Robitussin DM is an over-the-counter medication that contains dextromethorphan and guaifenesin. Mechanism of action. Dextromethorphan suppresses a cough by depressing the cough center in the medulla oblongata or the cough receptors in the throat, trachea, or lungs, effectively elevating the threshold for coughing. Indications for use. Antitussives are used for a dry, hacking, non-productive cough that interferes with rest and sleep. Considerations. This medication is not safe for children under the age of 4 years. Adverse effects. The most common side effects include nausea and drowsiness. Some patients may experience a rash or difficulty breathing. High doses may cause hallucinations and dissociation, and their drug has been reported to be used as a recreational drug. Patient education. Patients should take care to avoid irritants that stimulate their cough. Additionally, antitussive medications can cause drowsiness, and patients should avoid taking them with other CNS depressants or cough. Expectorants. Guaifenesin is an example of an expectorant. Mechanism of action. Expectorants reduce the viscosity of tenacious secretions by irritating the gastric vagal receptors that stimulate respiratory tract fluid, thus increasing the volume but decreasing the viscosity of respiratory tract secretions. Indications. Expectorants are used for productive cough and for loosening mucus of the respiratory tract. Considerations. This medication is safe for all ages. Guaifenesin is only recommended for use during pregnancy and breastfeeding when benefit outweighs the risk. Adverse side effects. Guaifenesin may cause a skin rash, headache, nausea, and vomiting. Patient education. Patients should take care to avoid irritants that stimulate their cough. Additionally, the medication can cause drowsiness. Patients should avoid taking them with other CNS depressants or alcohol. Respiratory pharmacology, beta-2 agonists. Albuterol is an example of a short-acting beta-2 agonist. Salmeterol is an example of a long-acting beta-2 agonist. Mechanism of action. Albuterol and salmeterol stimulate beta-2 adrenergic receptors in the smooth muscle of bronchi and bronchioles, producing bronchodilation. Beta-1 receptors can also be inadvertently stimulated, causing tachycardia. Indications. Short-acting albuterol is used to prevent or treat bronchospasms in people with asthma, reversible obstructive airway disease, or exercise-induced bronchospasm. Long-acting salmeterol is used to prevent bronchospasm. Adverse effects. Beta-2 agonists can cause muscle tremor, excessive cardiac stimulation, and CNS stimulation. Patient education. Patients should be instructed to take medication as directed and report any sustained or worsening symptoms to their healthcare provider. When first using an inhaler, patients should be instructed to prime the inhaler unit prior to administering their medication. Use of medications like albuterol can cause an unusual taste in the mouth, and rinsing the mouth with water after use is permitted. Patients should have an understanding of medication onset and use short-acting and long-acting inhalers appropriately. Long-acting beta-2 agonist, salmeterol. Salmeterol has a slow onset of action and will not abort an acute bronchospasm. The increased risk of death with use during an asthma attack due to slow onset of action. Prevention of bronchospasm. Tachycardia, dysrhythmias, hypokalemia, hyperglycemia, paradoxical bronchoconstriction, and increased risk of asthma-related death. Patients should be instructed to take medication as directed and report any sustained or worsening symptoms to their healthcare provider. When first using an inhaler, patients should be instructed to prime the inhaler unit prior to administering their medication. Use of medications like albuterol can cause an unusual taste in the mouth, and rinsing the mouth with water after use is permitted. Patients should have an understanding of medication onset and use short-acting and long-acting inhalers appropriately. Albuterol is an example of a short-acting beta-2 agonist. Salmeterol is an example of a long-acting beta-2 agonist. Albuterol and salmeterol stimulate beta-2 adrenergic adrenergic receptors in the smooth muscle of bronchi and bronchioles, producing bronchodilation. Beta-1 receptors can also be inadvertently stimulated, causing tachycardia. Indications for use. Short-acting albuterol is used to prevent or treat bronchospasms in people with asthma, reversible obstructive airway disease, or exercise-induced bronchospasm. Long-acting salmeterol is used to prevent bronchospasm. Beta-2 agonists can cause muscle tremor, excessive cardiac stimulation, and CNS stimulation. Patients should be instructed to take medications as directed and report any sustained or worsening symptoms to their healthcare provider when first using an inhaler. Patients should be instructed to prime the inhaler unit prior to administering their medication. The use of medications like albuterol can cause an unusual taste in the mouth, and rinsing the mouth with water after use is permitted. Patients should have an understanding of medication onset and use short-acting and long-acting inhalers appropriately.